A few moments later.
Auntie, I'm thirsty. Okay, let me get your water. I'm gonna get some water there from the faucet I saw earlier.
No, you should not drink water from the faucet. You don't know what bacteria it may contain. And maybe it has a parasite and it will grow in your body.
What is parasite?
Parasites are those living organisms that live in or on a host for nourishment and survival. You yourself is a potential host. There are a lot of parasites out there that you haven't seen yet. One of these is the Balantidium coli. Do you know what Balantidium coli is?
No, Auntie, what is that?
Those are the largest protozoan parasites of humans. It is the only ciliate known to be capable of infecting humans. It is often associated with swine, the primary reservoir host. During its life cycle, two stages exist: the active trophozoite stage, which inhabits the hindgut, and the resting or resistant cyst stage, which is shed with the feces and is the transmissible stage to new hosts. The parasite can infect a wide range of mammals, pigs being the main reservoir. The organism has also been found in some birds.
And in what way does it affect us?
Balantidium coli infects our large intestine and produces infective microscopic cysts that are passed in the feces, potentially leading to reinfection or infection of others. Do you know that in most cases, B. coli is not considered a public health problem because infections are usually asymptomatic? However, in some circumstances, the parasite could invade the intestinal mucosa, causing a disease known as balantidial dysentery or balantidiasis, which could be fatal. Transmission from one infected individual to others is by a fecal-oral route, in which contaminated drinking water or food are the main modes of transmission. Close contact with pigs and poor condition of the water sources are the main risk factors associated with the infection by the parasite.
How do they know about it?
It was first isolated from dysenteric stools of two patients in 1857. Dysentery is also actually an intestinal infection that causes diarrhea with blood, and the mucus can be also found in the stool. A report of a morphologically similar species in the pig intestine followed soon after. Following ingestion, the cysts insist in the small intestine, releasing ciliated motile trophozoites that colonize the lumen of the large intestine, where they feed on bacteria. Balantidium coli has a simple life cycle comprising dormant cysts and replicating potentially invasive ciliated trophozoites.
What are trophozoites?
The trophozoites are oval in shape, 50 to 00 micron by 40 to 70 micron. At the pointed anterior end is a mouth or cytosome, which leads to the cytopharynx, occupying about a third of the parasite length. At the more rounded anterior end is the anus, or the cytophage. Trophozoites are binucleate and replicate asexually by lateral transverse binary fission. Trophozoites may undergo encystation as they move down the intestinal tract, producing infective cysts, which are spherical or slightly ovoid, measuring 40 to 60 micron, and contain a micro and macronucleus. Cysts are observed in formed stools, whereas in cases of acute dysentery, encystment may not occur, and trophozoites are shed and also need to be looked for during laboratory diagnosis. Nevertheless, it is the environmentally robust cysts shed in feces that are regarded as responsible for onward transmission of infection, as it is widely thought that trophozoites cannot survive the low pH of the stomach. However, trophozoites were reported in the colon following experimental trophozoite inoculation of guinea pig stomachs. Some trophozoites invade the wall of the colon, multiply, and cause flask-shaped lesions, and clusters called nides or nests in the submucosa. Where there is extensive damage to the wall of the colon, blood may be present in stools and blood cells observed in trophozoites.
How does Balantidium coli get into our body?
B. coli invades the intestinal mucosa from the terminal ileum to the rectum. About one-half of infections are asymptomatic. The other half result in a subacute or chronic diarrheal illness with abdominal cramping, nausea, vomiting, weight loss, and occasional low-grade fever. Balantidium coli is a single-cell parasite, usually infects pigs or camels, but can, in rare cases, jump hosts and cause intestinal infection in humans. Direct contact with pigs is the usual transmission mode, or even by drinking contaminated water, usually in tropical regions.
Is there any medication against Balantidium coli?
There are 3 medications that are used most often to treat Balantidium coli. We have tetracycline, metronidazole, and iodoquinol. However, human cases are underreported, and a detailed review of the literature finds at least 246 medical reports from 1945 onward. Some cases are mild, while others can be fatal, especially if the patient is immune compromised. Several countries suspect that infections within humans are more widespread than commonly reported. For individuals with early localized infection, oral administration of doxycycline remains a first-line treatment, since it is effective against not only Borrelia bacteria but other infections transmitted by ticks. However, doxycycline is contraindicated in children less than 8 years of age, as well as pregnant women or those breastfeeding children, and can be phototoxic. Alternatives to doxycycline include amoxicillin, cefuroxime acetyl, and azithromycin, a potent semisynthetic derived from erythromycin. The semisynthetic azithromycin is recommended only in cases of intolerance to other antibiotics. Ticks transmit the human strain of babesiosis, so it often co-occurs with other tick-borne illnesses such as Lyme disease. When doubts arise in diagnosis between either Lyme disease or cellulitis, treatments are used that are effective against both infections, which are cefuroxime or amoxicillin or clavulanic acid. Extracts were prepared from elderberry and are claimed to be useful against Balantidium coli. Worldwide prevalence is low, estimated less than 1%, with most cases reported in a few endemic areas, which prevalence could rise up to 30%. Most infections are asymptomatic, but the organism could in some cases produce a severe infection and even the death of the host, usually associated with other concurrent illness. Waterborne transmission has been documented in some cases. Most cases are asymptomatic. Clinical manifestations when present may be acute or chronic, with abdominal symptoms. Complications of associated diarrhea or dysentery can occur in protracted infections. Symptoms may be severe or fatal in debilitated or immunocompromised persons. Extraintestinal infection is rare but potentially serious and typically occurs secondary to intestinal infection. Peritonitis and liver abscesses have been noted following intestinal perforation or rupture of fulminant colonic ulcers. Invasion of urogenital tract may be caused by contamination from the anal region or through fistula caused by severe infection.
They are scary, Auntie. From now on, I will carefully check the water I am drinking.
Yes, you should be careful on what you just eat or drink, and also in your environment. So in this way, you can stay away from the parasites.
Thank you, Auntie. I learned something today because of you.
Aww. Okay, so let's get your water. Just a few minutes away from here. It's better to be safe than sorry. Okay, let's go.